Welcome back, everyone, to a Diagnosed Brave video. And today is part two, and we're going to be talking about what's been going on this week with my mom and her recent diagnosis of breast cancer, and things that we have both learned along the journey this week. And so, just to recap, last week we ended with the fact that she had seen two surgeons, she had gotten the genetic testing done, and we were going to be heading to Cleveland to get that third opinion and then make the decision on which surgeon and hospital she wanted to move forward with so that we could get the MRI done, because both the genetic testing and the MRI needed to be done before the surgery. So we headed out to Cleveland earlier this week, and it was really nice because they were able to schedule the entire care team all in one day. So we only had to stay out for a night. We saw the surgeon, and she agreed with what our other surgeons back home talked about as far as with the DCIS. These were the two treatment types that she would suggest. But the further information that I got from the Cleveland surgeon was discussing how there's criteria as far as, depending on your age, is how they also can treat the type of cancer that you have. And so she was talking about how after a certain age, they don't take it as aggressively. And that was kind of surprising to me, but I am also used to the insurance companies dictating things that doctors are able to do. And so my guess would be as a cost savings to them, so they don't have to shell out the money. That's just my guess. But her sharing that, these are things that she would look for and this is how she would do the surgery, just reaffirmed, I think, to my mom that, we really did have two options, and that any facility that we chose, it would be fine with, and they would do the same kind of thing. And so we then met with someone from the oncology department that handles the radiation. And it was the first time I spoke with a doctor regarding what radiation therapy was. I had only heard people share what their experiences were previously. And it was interesting to hear him discuss the different methods of how they've changed how they distribute the radiation, to the fact that he's been working on things that have been lessening the side effects of radiation for patients. And again, I attribute that to the fact that, Cleveland Clinic is really big into studies, and they're able to have a lot more tools and get funding for those kind of things. But even hearing how he addresses the type of therapy and how long he would estimate it to be, in my mom's case, he was, suggesting it would be about a week, so 5 days worth. And just going over the side effects and giving us a bigger picture than we had gotten from the other surgeons. And then we saw another specialist and kind of went over the recovery and everything, to the fact that when we went to the hotel afterwards in the evening and talked about it, my mom shared that she thinks she would feel more comfortable having the surgery closer to home, just in case anything were to happen. It was like a comfortability factor. So she wanted to move forward with Rush, and at least we had gathered all the information. And I think that just helps to make a more informed decision, which, as I said in previous videos, you definitely don't want to be second guessing what type of procedure or surgery you have while you're having it or directly afterwards. So more information in this case, I think, helps. And because we had already held the spots for the MRI at the various hospitals, I was able to cancel them and hold the one for Rush, which was actually this week. So as soon as we got back from Cleveland that next morning, we were able to go downtown, and she completed the MRI. And so we're just waiting on those results. to move forward. We did get the results from the genetic testing. And, that was really interesting too, because I remember a number of years ago, I reached out to my doctor because I had read a lot in the news about, these celebrities that were getting tested. And if they were, I believe it was BRCA positive, that meant their likelihood of having breast cancer was higher. And so a lot of these celebrities were getting mastectomies done. And so I was like, hey, can we test for it? And my doctors at the time told me that, there wasn't enough to verify having the test, and that they also didn't feel that just automatically getting a mastectomy was like solving the problem, like a solution to the problem. And so I would have to not only pay for the genetic testing out of pocket, which was quite expensive a number of years ago. So that just kind of dropped to the side. So with my mom getting the genetic testing done, I was really blown away by the fact that there are 76 different genes that can have mutations that would dictate the type, the likelihood, the severity of the type of cancer a person could have, along with, they could show which mutations were genes and which mutations were environmental. And that really piqued my curiosity because, as far as an autoimmune disease, I still participate in a lot of studies because they don't quite know how somebody gets vasculitis. They haven't been able to pinpoint it on genes or a specific type of environmental factor. So for myself, over the years, when people are like, oh, how did you get vasculitis? Like, my best answer is I don't know, dot, dot, dot. It could be genetics or it could be environmental. And there are studies that are going on year round over the last many years. And so I hope we get closer to figuring it out. But it was really neat when we went back in this week to go over the genetic results to find out like how they can drill down and be so specific. And as a side note, the woman who did the genetic testing was like, yeah, I just do this for, breast cancer. And then sometimes I do it for other cancers. But then there's genetic counselors that just do stuff for cardiovascular issues and just do. And I was like, they do that nowadays? Like, wow, okay, that's something new. So definitely learning a lot through this process. And I've noticed through this week, my mom has reached out to a few of her friends to share with them what she's been going through. But overall, she's not quite ready to let family, friends, and everyone know. And, you have to respect that with someone because it's their decision when they reveal to people about their health stuff. I mean, I know that I had experienced that as a patient, and it would be frustrating when somebody would like tell my medical business to somebody. So in this case, last week, I let my mom know, would it be okay if I told two or three of my closest friends? Because I realized I needed to have my own support group outside of my family. And in order to do that, I needed to tell them why I needed their support. And I was trying to be respectful and not like spread her news everywhere. But she told me she understood, and so I was able to confide in some people, and that was able to help because last week, even in Cleveland, I was like, wow, I really need to just talk to somebody. And, I was able to have that outlet. So as a caregiver, just as much as with a patient, you want to try to have at least a few people of your tribe so that when you need to lean on them, that you have them kind of ready and available and they know. Because the last thing you want to do is truly reach out to somebody while you're upset, explain to them why you're upset, explain to them that you've been, battling or going through this roller coaster of a journey for so long, and then informing them while you're upset about something. That's just a disastrous cocktail. So so it was good to be able to kind of share with some people that, this is what I'm going through, and I might need a moment where I need to vent or I want to celebrate something. And so I want to be able to share that with somebody. So I was able to kind of get my support group together. And I'm in the process of even trying to get my dad to have a little bit of a support group to help him because, again, everybody handles medical news differently. And, when you're the patient and you don't have control of what your body is doing, it is extremely frustrating. And that's where I spent a lot of time mad at myself, mad at the world, mad at God, because there was nothing that I felt like I could do. And I feel now as the caregiver, I'm sort of stuck in that position again because I don't have a magic wand to try to fix what's wrong with my mom. And I can't perform the surgery, and I don't have the medication that's going to cure everything. But what I have to remind myself, and I encourage you to remind yourself with, is just you being there as that supportive person is huge for that patient. And don't discount yourself of like, oh, there's nothing I can really do, even if it has to do with making dinner for somebody or offering to help with laundry or cleaning or running to the grocery store. Those are huge things. Those are things that really help out. I know myself when I'm recovering from surgeries, like, people will bring over, food, and they will offer to, take me to any appointments, or, do you need a Walmart or Jewel pickup order? Which, when somebody suggests, it's kind of like, oh, no, that's okay. I'll figure out how to do it myself. But even not having to run as many errands as you normally do while you're recovering, like your number one priority when you're recovering is to take care of yourself. And in all honesty, you can't take care of yourself if you're still running errands and cleaning everything and fixing everything up. So letting other people who want to support you help you, that goes whether you're the patient or you're the caregiver. So accept the help when you can. I know it's not easy, but if you can, try to accept it. So we were able to get her results from the genetic testing done, and they actually came back really good. There weren't any mutations gene wise. There was something that looked off, but they said that they categorize whatever that mutation was for that gene as more of an environmental factor, and it doesn't necessarily play a role with this and other types of breast cancer. It's just something that shows up. I guess they used to be more like, oh, if this shows up like this, it means X, Y, and Z. And now they're at a point where they don't view the mutation to that specific gene like they used to. And so that was really good news. Her MRI went pretty smoothly. She did have to have some contrast. And that was something that I don't think the doctor or care team really went over with her, because when we went in the back and she was prepping for it and they were talking about starting a port, and she kind of immediately was like, wait, why are we doing this? And what do you mean by contrast? Because I think a lot of people view like CTs and MRIs the same. And so with CTs and like PET scans, they use more of like a radioactive type of dye in your system. And so people get really hesitant of like, oh, they're going to put that in me, but when it comes to an MRI, it's a different kind of contrast because the MRI is using magnets, and so they don't have to use the same type of contrast dye like they do in other tests. So once that was kind of explained to her, it was a pretty smooth process. It was over within 20 minutes, I believe. It definitely took us a lot longer to get to Rush Hospital downtown driving than it did for the whole test. So that was a blessing in disguise, because when you first make the appointment and they're like, yeah, it's a 45-minute MRI, and you're thinking, okay, how am I going to stay in this position for that long? And I know that was a concern of hers. So it was really great that they were able to get it done in 20 minutes. So we're going to find out what the results of the MRI are next week. And I'm excited because she did, choose Rush, and she feels confident in that. And she's even kind of seeming a little bit brighter. And I think when you're able to make more of the decisions and feel a little bit more in control of what's happening, that the plus side to that is your mood improves. It's not going to be perfect. You're still going to have your roller coaster days of how you feel a bunch of different emotions, and that's totally allowed, both as the patient and the caregiver. But at least this way we know, okay, we chose this hospital. This is where the surgery is going to be. It's going to be with this doctor. And our timetable is still looking pretty good, because even once we get the results of the MRI, the doctor said that within 2 to 3 weeks, she should be able to fit my mom in for surgery. So we'll definitely be underneath that 60-day window. So that's excellent. And we did find out from some people that it is extremely helpful to either have like button down shirts or the bras that open up in the front. So those are just, to me, go under the category of like medical supplies to have on hand. So like I told her, we will find time this next week to go to like a resale shop and get a bunch of those button down shirts, and then look more into what kind of post-op bra would be best, and then anything else that would help as far as comfortability with sleep and everything. So I know we're still leaning between the two different surgeries. She hasn't quite decided which one, but I think we have all the information we're going to possibly have on either one, so that once we get the MRI results, we should be able to move forward with a decision. And it's just been wonderful to be able to gather this information in such a timely manner. So it is possible, and I encourage, if you have any questions or comments, drop them below. I will check them and hopefully answer them within the next few videos. I hope you have a great day.